I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
I get this question a bazillion times every single day, all the time. That's an exaggeration, but we get asked about ADHD so much.
We do, and a lot of you have been asking about it on social media, so we thought we'd talk about it today.
Maybe it's important. Go back and watch the ADHD video. ADHD in women is really important because it gets missed all the time. So even with or without a diagnosis, these risks exist.
Yeah.
So that would be good to go watch that first. Pause here and go do that. But if you have an idea of what ADHD is in women, it looks a little bit different from ADHD in men. So risk of untreated illness.
So risk of untreated ADHD in women. What we have kind of noticed in studies, because we haven't really there haven't been like great studies on this in general, but the small studies that have been there have shown that and this is just in women in general, that there could be increased risk of safety issues, like maybe more car accidents or
substance
use, or they're just not functioning at the same level as women who have treated ADHD. And there was a study done by Mass General Hospital looking at their functioning in women who continued treatment during pregnancy versus women who discontinued treatment during pregnancy for ADHD. And those who continued treatment had better functioning. They reported feeling more centered and more accomplished. And women who discontinued treatment had poorer functioning, but they also had a higher risk of depressive symptoms, which was interesting because this was a cohort of women who did not have a history of depression.
And we know what the risks of depression are with untreated depression. We have a specific video on risk of depression during pregnancy.
Yeah.
And so if you kind of take that information and move it to the next understanding, is that untreated ADHD is not risk-free.
Yeah, it's not risk-free. And so I think that's something that needs to come into the conversation when a person is trying to decide, should I continue my ADHD medication in pregnancy or not?
You've seen someone who is so inattentive that it's dangerous. Right? They're inattentive with their driving, or they're inattentive with cooking, or they're inattentive at times where it requires attention to be safe. So ADHD, if severe, can be risky, very risky.
Well, and not to mention, for a lot of people, ADHD treatment is important in their ability to function at work, and losing your job or having a lot of work stress because you're not able to function there can have huge impacts on people's lives too.
So additionally, pregnancy related, with ADHD, treatment or no treatment, risk of preterm birth is higher, right?
Yeah, risk of preterm birth in baby and risk of low birth weight in baby. So regardless of whether you treat ADHD or not, we see that women with a diagnosis of ADHD, their babies have some risks that babies and moms without ADHD don't have.
So taking that information and moving that into the next thing, what do we do with treatment? There's two classes of stimulants that we traditionally use to treat ADHD, and we're going to talk about those two. Of course, there are other treatment options for ADHD, but we're going to talk specifically about the stimulants today. So there is the amphetamine class of stimulants, and then there's the methylphenidate class of stimulants. So the amphetamine class is medications like Adderall, Vyvanse. Those are like the two big ones that people know. And then there's like a million versions of like this salt or this extended release or that extended release. So the ones you've probably heard of are Adderall or Vyvanse.
I think we should also take a step back and just recognize that the research on stimulants in general is really limited. And so that's another reason we're only including these two classes of medications, because even the other classes, which aren't used as commonly, like the research is even tinier. And so we're not even going to bother with those right now.
Right.
Give us more research.
Maybe there's more information to be had.
Yes.
But, anyway, there's a million bazillion problems with mental health treatment for women, treatment during pregnancy, studying things during pregnancy. It's just, we could go on and on and on. But okay, let's focus.
Okay.
The stimulants, especially the amphetamine class.
Amphetamine class, the big risk with amphetamine class that has been shown in some studies is that it might increase the risk of hypertension in the mom when she's taking it after 20 weeks gestation. But this, again, it was very small research studies, and not all research studies have shown that. There's a questionable risk of preeclampsia as well. There has been something that's a little bit more consistent, and that is neonatal adaptation syndrome and NICU admission in babies who were exposed to amphetamines during the pregnancy versus babies who are not. There's also some studies showing that there might be some fetal growth restriction in terms of fetal head circumference can be smaller in some babies exposed to this medication versus not. Again, limited research and not consistent.
Right, and when something isn't consistent, that tells me that we just need more information.
Yeah.
At what doses, at what time in pregnancy, for maybe there's another factor happening here, right? It's like people with ADHD and this genetic component, or blah, blah, blah.
Yeah, we just don't know.
We just don't know. Should we move on to the methylphenidate class? Yeah. Okay, so generally, same thing with the methylphenidate class. The studies are very limited. They are, of course, mixed. There is some information to support the idea that with methylphenidate exposure during the first trimester of pregnancy, there might be an increased risk of cardiac malformations for baby. Some studies find that, some studies do not find that. The ones that do find that slight increased risk also have some issues because they studied things like a prescription written for XYZ medication, right? So that doesn't equal taking that medication. There's a big gap there and a big assumption that a prescription written means medication taken. So some studies are well done. They are very small, but they do not show that. Some studies are larger and they also don't show that. Some studies are larger and they do show that. So again, I think it's one of those things where it's probably we need more information. It's probably something related to another thing that we haven't thought of yet. There is a small increased risk of cardiac malformations is what I tell my patients, because I don't want to not give that information and it be true. So I do have that conversation about the nuance with the methylphenidate class of medications, but I would like to say there's no risk, and I don't know that I can say that.
Yeah.
Right. I think there's also enough information to support the idea that there might be an increased risk of spontaneous abortion or miscarriage with the methylphenidate class of medication. That is something to definitely consider, and also it's likely that that is somewhat related to simply having ADHD based on some of the studies that they've done. So
I think it's also important that we look at research on just stimulants in general, and they've found that there's no increased risk of any kind of neurodevelopmental disorders, so ADHD, autism, cognitive disorders, and this is in women who were treated with stimulants for ADHD in pregnancy. Interestingly, though, this study also showed there was no increased risk of growth restriction, even though I just said that amphetamines in some studies have shown an increased risk of growth restriction. So again, it's all like mixed. This study on looking at just stimulants in general also showed there was no increased risk of seizures or seizure disorders in babies exposed to ADHD medications in pregnancy.
So I think if we take all of the information, if we have something that is very clearly risky, ADHD, and we have something that may or may not be risky, we look at the risk for the individual.
Right, because for some individuals, their ADHD might not be that risky. It might be a nuisance, but maybe it's something that they feel like they can manage 9 months of without having treatment. Other individuals, it can be really impairing, it can be really detrimental to their safety. So it's really kind of weighing the risks for each individual. And it's also a very personal decision. I'm not a fan of doctors who tell their patients, like, you absolutely have to stop this medication or you can't take it in pregnancy. It really needs to be a discussion based on your personal history and what's going on in your life currently.
Yeah. Oh, I hate that thing, like, you can't XYZ or you have to XYZ. No, you don't. Yeah. You can do whatever you want. You just have to understand what the consequences of that decision could be.
Yeah. Well, and I guess it also depends on the prescriber, right? Like, some prescribers just are not comfortable prescribing it in pregnancy. That doesn't mean that it's wrong to take it in pregnancy. It means that person is not comfortable with it, and maybe it means finding a second opinion or somebody who can have a more detailed discussion with you about the risks of taking a stimulant in pregnancy versus the risks of stopping the stimulant.
If we think about the standard of care for ADHD treatment during pregnancy, the ideal situation is that someone is able to manage their symptoms without medication. I think that's always the ideal situation, that we're able to manage symptoms and get symptom free without medication. So I think if you're planning pregnancy, trial a lower dose, trial off of medication, trial other things that could augment your treatment, and see if there is a possibility for risk reduction for you in any way. And then if you know I can't get by without my medication, then you know you're doing the least risky thing.
Yeah, that's an excellent point. Like, planning out ahead of time, if that's a possibility for you, that can clear up a lot of questions that you might have about continuing or not continuing your treatment in pregnancy. One medication that is FDA approved for ADHD that we do have more research on is Wellbutrin. And so it might be having a trial of Wellbutrin before you ever get pregnant and seeing, hey, does that one work for me? And that you might feel more comfortable taking during pregnancy than a stimulant that we don't have as much information about.
Right, so it's really personalized, as is everything during pregnancy. From naming your child to taking medication, it's all very personal, and you get to kind of guide that conversation and decide what's right for you. So hopefully having the information makes you feel more comfortable with the decision that you have made for yourself, or you feel comfortable bringing it to your physician and say, like, hey, I have this information, what do you think about it? So that you can have an informed discussion based on your specific circumstances and make a decision that's right for you confidently.
And two really great resources that I think we should mention that maybe you could take to your doctor to start this discussion is mothertobaby.org. They have fact sheets on amphetamines and methylphenidate medications. They also have a blog post. You might have to Google mothertobaby.org and ADHD treatment, but they have a whole blog post that was really well written about kind of comparing those risks that we just discussed. And then also womensmentalhealth.org, which is run by Mass General Hospital. They have several different articles looking at the risks of ADHD treatment and even the risks of not treating it.
Very reputable source, motherbaby.org and womensmentalhealth.org, very reputable sources for information, just kind of gathering and bringing it to your physician and educating yourself. That's quite dense, right?
It is quite dense.
It's quite dense, yeah. But it's important.
For sure.
Yeah, I mean, untreated illness is like not risk-free, so. Thank you for being here. Please like, comment, subscribe, share with your friends. Let us know what you want to learn about. We'll see you soon.
Bye.